Every 66 seconds, another senior in this country gets handed the word dementia. By the time this video wraps up, 20 more families will have heard that exact diagnosis. And for some of them, age was never the true cause. It was a bottle sitting right there on the bathroom shelf, the one they've been promised was safe. I'm Dr. William. After 15 years in practice, I've watched the same scene play out more times than I can count. Someone who is mentally sharp their entire life starts to lose the thread. Names, appointments, the drive home they've made 1,000 times. And everyone around them writes it off as getting old. It wasn't aging. It was a medication. One that almost nobody thinks to question because a doctor signed off on it and a pharmacy filled it without hesitation. Here's what the newer research keeps confirming. One ordinary everyday class of drug can pull your memory and learning down hard within a single year. And most people taking it have no idea it's even happening. Today, I'm taking you through the 9 medications most closely tied to fast memory loss. Counting down from the ones that quietly fly under the radar to the one I consider the most destructive of all. Watch closely for number 3. It's given to millions of seniors for something that sounds completely harmless. And it may be shrinking your brain's memory centers right now without a single warning sign. Before we get into it, tell me in the comments how old you are and what medications you're taking daily. I read everyone, and the age of this audience shapes what I cover next. Let's kick things off at number 9. And don't let its low ranking fool you because this one is sitting in nearly every medicine cabinet in America. Number 9 is diphenhydramine. You likely know it by its drugstore name, Benadryl. It's a little pink pill reach for to drift off to sleep, calm an allergy, or take the edge off a cold. It costs only a few dollars, sits out on an open shelf, and most people figure that since it doesn't require a prescription, it must be gentle. Inside your brain, something quite different is going on. Benadryl falls into a class of drugs called anticholinergics, a long term for a simple concept. They block a brain chemical called acetylcholine. Acetylcholine is the messenger your brain relies on to lay down new memories and to stay alert through the day. As we age, the brain produces less of it and leans even harder on whatever remains. So, a drug that blocks it hits a 70-year-old brain much harder than a 30-year-old one. The structure that takes the brunt of it is the hippocampus, the small seahorse-shaped region where new memories are formed before being stored away. In my own practice, I've seen patients take a nightly antihistamine for years and slowly lose their edge, never connecting the fog to the pink pill beside the bed. The research is blunt about this. A 2023 paper in the Journal of Geriatric Cognitive Health tracked older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared with those who steered clear of them. More than half again the usual risk from something most of us treat like candy. Here's what to do. Look at the label on anything you take to sleep and anything marked PM, nighttime, or allergy relief, because those are very often just Benadryl wearing a different name. If you take it for allergies, newer antihistamines like Loratine, sold as Claritin, don't cross into the brain the way Benadryl does and are considerably safer long-term. Never stop a medication on your own. Bring it up with your doctor first. But stop assuming that over-the-counter automatically means harmless for your memory. That's number 9. Number 8 is something your stomach is grateful for while your brain quietly foots the bill. Number 8 is proton pump inhibitors. The big names are omeprazole sold as Prilock and esomeprazole sold as Nexium. These shut down acid production in the stomach and get prescribed for heartburn, reflux, and that burning sensation after meals. People stay on them for years, sometimes decades, because the moment they stop, symptoms come roaring back. So, it feels like the drug is the only thing keeping things in check. Here's the part almost nobody hears at the pharmacy counter. Your stomach needs acid to pull certain nutrients from your food, chief among them, vitamin B12, which protects the wiring of your nerves and brain. Turn the acid down far enough for long enough, and your B12 quietly slips. So do magnesium and calcium, 2 minerals your brain cells depend on to fire and signal correctly. Starve neurons of those, and you end up with misfires, confusion, and memory slips that mimic early Alzheimer's. When the real cause is a nutrient, your medication has been blocking the entire time. In 2016, a large study in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular PPI users showed a 44% higher risk of dementia than non-users. And the issue runs deeper than nutrients, since PPIs have also been shown to raise amyloid beta levels in the brain, the sticky protein that builds up in Alzheimer's disease. So, here's the move. If you take a PPI every single day, that's worth bringing up with your doctor. Many people can step down to a gentler class called H2 blockers, like Fodin, sold as Pepsid, which is far less likely to affect cognition. Chewing delisrinated licorice, a natural compound that coats and soothes the stomach lining, can ease symptoms with no cost to the brain whatsoever. The goal is the lowest dose for the shortest duration, not a pill taken forever purely out of habit. Number 7 is prescribed for an issue most people would rather avoid discussing. Number 7 is bladder medications, and the one worth knowing by name is oxybutynin, sold as Ditropan. It's given to seniors dealing with sudden urgent trips to the bathroom, the kind of overactive bladder that can take over an entire day. The relief is genuine, and the embarrassment it spares people is genuine too. But oxybutynin works by blocking acetylcholine, the same memory chemical Benadryl blocks. And this one slips into the brain very easily, lodging right where memories form. That makes it one of the riskier entries on this list for an older adult, particularly with prolonged use year after year. In 2019, the British Medical Journal published a study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their dementia risk climbed 49% higher, close to 1 in 2. And here's what troubles me most. Almost none of them were ever warned. They were told a pill would settle the bladder. Nobody mentioned it might also be dimming their mind. The fog gets pinned on age. People describe forgetting appointments, misplacing their keys 10 times a day, losing track of a simple conversation, and everyone around them nods and says, "Well, you're getting older." It's rarely traced back to the prescription until real ground has already slipped away. If you take oxybutynin and you've noticed your memory fading, take that seriously because you don't have to choose between your bladder and your brain. Newer drugs like Miragron, sold as Myrbetriq, work through a completely different pathway and don't block acetylcholine at all. For most older adults, they deliver similar control with far less cognitive risk. Bring it up at your next visit. Number 6 might be the most unexpected entry on this list since it's one of the most prescribed drugs anywhere. Number 6 is statins. Svevastatin and atorvastatin, sold as Zocor and Lipitor, rank among the most widely prescribed medicines in the world, especially after age 60, and they do crucial work lowering cholesterol and cutting the risk of heart attack and stroke. Statins have a rightful place in a lot of people's lives, and this isn't an argument against using them. What follows is the half of the story that usually gets left out. Cholesterol does far more than affect your heart. Your brain is close to 60% fat, and it relies on cholesterol to build the myelin sheath, the insulation wrapped around every nerve, so signals travel quickly and cleanly. Push cholesterol down hard enough with a strong enough statin, and you can leave the brain short of a raw material it genuinely needs. The statins causing the most trouble are the ones that pass easily into brain tissue. In 2023, a study in Frontiers in Aging Neuroscience found that adults over 70 who'd been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment. And the higher the dose, the sharper the decline. Some patients describe unsettling gaps. A familiar name vanished. A conversation just finished forgotten. A route driven for 20 years suddenly unfamiliar. The key point to grasp is that not every statin affects the brain identically. Pravastatin and fluatin don't cross into brain tissue as readily and are generally seen as safer picks for preserving cognitive function. So if you've been on a statin for years and you're noticing fog, forgetfulness, or confusion setting in, that's a genuine conversation to have with your doctor about a lower dose or a switch. It's not a reason to quietly stop a medication that may be guarding your heart. Get the plan right with professional guidance, never solo. Quick pause. If this is helping connect the dots for you, take 1 second to tap the like button. It helps this information reach more seniors who need to hear it. And while you're there, tell me how many prescriptions you're currently taking. I read every comment. Now, back to the countdown. Number 5 is benzodiazepines. Lorazepam Ativan, diazepam Valium, and alprazolam Xanax are among the most commonly prescribed medications for anxiety and sleep problems. They work by boosting GABA, the brain's natural calming chemical that slows an overactive nervous system. At first, these medications can feel like a lifeline. Anxiety eases, racing thoughts slow, and sleep finally comes. But over time, the picture changes. A 2022 study published in the British Medical Journal followed more than 8,000 seniors for 6 years and found that people who used benzodiazepines for longer periods had a 5.1% higher risk of developing Alzheimer's disease. Longer-acting medications like diazepam appeared even riskier because they remain in the body longer and can accumulate in fatty tissue, including the brain. These medications create a slow chemical sedation throughout the brain. Learning slows, mental flexibility declines, and many people describe feeling emotionally numb or as though they're moving through a constant fog. The hardest part is stopping them. If a benzodiazepine is discontinued suddenly, anxiety and insomnia can return even stronger, sometimes with dangerous withdrawal symptoms. That can make the medication feel impossible to live without just when it's causing the greatest harm. Here's the important rule. If you've been taking a benzodiazepine for more than a few weeks, never stop it abruptly. Work with your doctor to reduce the dose gradually over weeks or even months. Gentler alternatives such as buspirone may help relieve anxiety without the same sedation or mental fog, and specialized therapy for anxiety and insomnia can also be highly effective without the cognitive cost. Now let's move on to number 4. Number 4 is amitriptyline Elavil. This older antidepressant is still widely prescribed for nerve pain, sleep problems, and migraine prevention. Its versatility made it popular, but it's also one of the strongest anticholinergic medications still in common use. That means it powerfully blocks acetylcholine, the brain chemical your neurons depend on to communicate and form new memories. With long-term use, memory problems become far more than a rare side effect. A large 2015 study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the greatest long-term exposure to anticholinergic drugs like amitriptyline had a 5.4% higher risk of developing dementia. Most were never warned. They took it for pain or sleep, then gradually noticed forgotten words, fading memories, and difficulty concentrating, assuming it was simply part of getting older. Even low nightly doses taken for years can quietly reduce cognitive function without obvious warning signs. If you or someone you love takes amitriptyline, it's worth discussing safer alternatives with your doctor. For nerve pain, medications such as duloxetine or gabapentin may provide similar relief with less anticholinergic burden. For sleep, melatonin or a very low dose of doxepin may be gentler options. And for depression, newer antidepressants such as sertraline or escitalopram are generally considered safer choices for long-term brain health. Number 3 is the one I mentioned earlier because it's prescribed to millions of people for something that seems completely harmless. Number 3 is paroxetine Paxil. It's one of the most commonly prescribed antidepressants in the SSRI family and is widely used to treat depression and anxiety. On the surface, it appears to be a modern, gentle medication compared with many older antidepressants. But here's what many people aren't told. Paroxetine is the only SSRI with strong anticholinergic activity. That one characteristic sets it apart from medications like sertraline and escitalopram because it interferes with the same acetylcholine system responsible for learning and memory. A 2021 review published in Frontiers in Psychiatry examined older adults taking different SSRIs and found that those using paroxetine experienced measurable declines in short-term memory, word, recall, and attention within the first year. Seniors taking paroxetine were 30% more likely to show early signs of cognitive impairment than those taking other SSRIs. There's an unfortunate irony here. A medication prescribed to improve mental well-being may gradually reduce the mental clarity it was meant to protect. The good news is that safer alternatives are available. The American Geriatric Society includes paroxetine on the Beers criteria, a list of medications that are potentially inappropriate for many older adults because of their risks. If you're taking paroxetine, ask your doctor whether switching to an SSRI such as sertraline or escitalopram may be appropriate. Maintaining healthy levels of vitamins B12 and B6 may also help support overall brain and mood health. Now, let's move to number 2. Number 2 is antipsychotic medications. This one concerns me because many people taking these drugs don't even realize they're classified as antipsychotics. Common examples include quetiapine Seroquel, risperidone Risperdal, and olanzapine Zyprexa. These medications were originally developed for serious psychiatric conditions such as schizophrenia and bipolar disorder. Today, however, They're often prescribed off-label for older adults with sleep problems, agitation, restlessness, or behavioral symptoms related to dementia. Powerful medications designed for severe mental illness are now frequently used in hospitals, nursing homes, and care facilities for seniors who are confused or difficult to manage. The risks can be significant. A 2022 study published in The Lancet Healthy Longevity followed more than 25,000 older adults and found that those prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within 1 year, even without a previous diagnosis of dementia. These medications can also increase the risk of stroke, sudden cardiac death, heavy sedation, falls, and hospitalizations. They work by suppressing dopamine, a brain chemical involved in mood, focus, planning, and memory. When dopamine activity is reduced too much, thinking slows, emotions become flatter, and many people appear mentally distant even though they're physically present. If you or someone you love is taking one of these medications, ask the prescribing doctor an important question. Why was this medication started? And is it still truly necessary? Many behavioral symptoms can often improve through consistent routines, reducing noise and overstimulation, treating hidden pain, and improving sleep and lighting before relying on medication. When these drugs are genuinely needed, using the lowest effective dose for the shortest possible time helps reduce the risks. Too many families are never told how these medications can affect the brain. They assume the decline is simply aging, when in some cases the medication itself may be contributing. Now, we arrive at number one. Number one isn't a single medication. It may be the biggest hidden cause behind everything we've discussed. Number one is anticholinergic polypharmacy. It's a danger that few people talk about, yet it may be one of the leading causes of medication-induced memory loss in older adults. You were probably expecting one final worst pill. The truth is more complicated. The greatest risk often comes from taking several anticholinergic medications at the same time, with no one adding up their combined effect. Polypharmacy simply means taking multiple medications. Anticholinergic burden refers to the total effect of all those medicines blocking the same memory-related brain chemical at once. Imagine a common situation. A senior takes Benadryl every night for sleep, oxybutynin for bladder control, and amitriptyline for nerve pain. Each medication alone may cause only mild memory problems. Together, however, their effects add up, placing a much heavier burden on the brain. A 2022 study published in Age and Aging followed more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of developing dementia within 10 years, more than double the normal risk. Most had no idea they were taking multiple anticholinergic medications because no one had ever explained it to them. When acetylcholine is blocked from several directions at once, the brain doesn't simply slow down. Neurons become less active, connections can weaken, and the brain may begin to function much like it does in Alzheimer's disease. Here's the encouraging news, and the reason I made this video. Medication-induced cognitive decline is often reversible when it's caught early. Reduce the anticholinergic burden, and many people regain mental clarity, energy, and memory within weeks or months. The aging brain is often more resilient than people realize once the source of the problem is removed. The solution isn't complicated. Schedule a complete medication review with your doctor or pharmacist. Go through every prescription, every over-the-counter medication, and every supplement you're taking. Ask about your total anticholinergic burden. Simple assessment tools can help identify the risk. Once unnecessary medications are identified, they may be reduced or replaced under medical supervision with safer alternatives, giving your brain the best chance to recover. This may be one of the most preventable threats to brain health after 60, and that's exactly why it earns the number one spot. Now I'd like to hear from you. Which of these medications is currently in your medicine cabinet? Have you noticed brain fog or increasing forgetfulness after starting a new medication? Share your experience in the comments, and if you haven't already, make it a goal to ask your doctor or pharmacist for a medication review this week. Your story could help someone else recognize the warning signs. Before you go, remember this? Your medicine cabinet isn't the only place your body gives you clues. Your fingernails can reveal early warning signs involving your kidneys, your blood, and even your nervous system, often long before other symptoms appear. Most people never know what to look for. That's exactly what I'll show you in the next video. The 4 nail signs everyone over 60 should check tonight. Stay sharp, stay informed, and I'll see you in the next video.